Now we are on Lesson 3, Different Types of ADHD. Let's start it. ADHD, or Attention Deficit Hyperactivity Disorder, is a neurodevelopmentally disorder that is characterized by symptoms of inattention, hyperactivity, and impulsivity. According to the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition, there are 3 types of ADHD: predominantly inattentive presentation, predominantly hyperactive impulsive presentation, and combined presentation. The predominantly inattentive presentation is characterized by symptoms such as difficulty focusing, following through on tasks, and organizing activities. The predominantly hyperactive impulsive presentation includes symptoms like fidgeting, talking excessively, and acting without thinking. The combined presentation involves a combination of both inattentive and hyperactive impulsive symptoms. Understanding the different types of ADHD is crucial in determining the appropriate treatment and management strategies for individuals with this disorder. In the past, ADHD was recognized under different names and classifications. Early descriptions of the symptoms of ADHD can be traced back to the late 18th century when the term defective moral control was used to describe individuals who had difficulty controlling their impulses. In the early 20th century, ADHD-like symptoms were referred to as minimal brain dysfunction or hyperkinetic impulse disorder. It wasn't until the 1960s that researchers began to use the term attention deficit disorder, ADD, to describe the condition. The concept of ADHD as we know it today, with its distinct subtypes and diagnostic criteria, started to take shape in the 1980s and further evolved with the publication of the DSM-5 in 2013. Recognizing the historical context of ADHD helps us appreciate the progress made in understanding and addressing this complex disorder. Overall, gaining insight into the different types of ADHD according to the DSM-5 and the historical evolution of how this disorder was recognized can provide a foundational understanding of ADHD. By recognizing the specific symptoms and presentations of ADHD, individuals can seek appropriate diagnosis and treatment. Additionally, understanding the historical context of ADHD allows us to appreciate the advancements in research and clinical practice that have contributed to our current knowledge of the disorder. Moving forward, continued research and education about ADHD will help reduce stigma, improve support for individuals with the disorder, and enhance the overall quality of life for those affected by ADHD. ADHD, Attention Deficit Hyperactivity Disorder, is commonly classified into 3 main types based on the predominant symptoms experienced by the individual. These types are recognized by the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition, which is the standard classification used by mental health professionals. 1. ADHD, Predominantly Inattentive Type, ADHDI. This type of ADHD is characterized primarily by difficulties with attention and focus rather than hyperactivity. People with this form of ADHD may not exhibit significant hyperactive or impulsive behaviors. Common symptoms include difficulty sustaining attention in tasks or activities, frequently making careless mistakes in work or school assignments, trouble organizing tasks or activities, avoidance of tasks requiring sustained mental effort, e.g., schoolwork, paperwork. Often losing things necessary for tasks, e.g., keys, books. Easily distracted by external stimuli or unrelated thoughts. Forgetfulness in daily activities, e.g., forgetting appointments. Typical traits. Often described as daydreamers. May appear spacey or disinterested in conversations. They are likely to be overlooked in childhood, as they may not exhibit disruptive behavior. 2. ADHD, Predominantly Hyperactive Impulsive Type, ADHDH. This type is characterized primarily by hyperactivity and impulsive behavior rather than problems with inattention. Common symptoms include fidgeting with hands or feet or squirming in the seat. Inability to remain seated in situations where it's expected. Running or climbing in inappropriate situations. Difficulty engaging in activities quietly. Talking excessively. Interrupting or intruding on others, e.g., butting into conversations. Acting impulsively without thinking about consequences, e.g., yelling out answers. Typical traits. Often described as restless or always on the go. They may have difficulty following rules or waiting their turn. It is more noticeable in younger children, especially in structured environments like school. 3. ADHD, combined type, ADHD-C. This is the most common form of ADHD, where individuals display a combination of both inattentive and hyperactive impulsive symptoms. These individuals struggle with both focus and control over hyperactive behaviors. Common symptoms include a mixture of symptoms from both inattentive and hyperactive impulsive types. Difficulty paying attention, organizing, and completing tasks. Also showing signs of restlessness, impulsivity, and excessive talking or fidgeting. Typical traits. Both inattention and hyperactive impulsive symptoms are present, but not necessarily to the same degree at all times. Due to the blend of symptoms, individuals with this type tend to have more noticeable difficulties in social, academic, and work environments. Other important considerations. ADHD in adults. While ADHD is often associated with children, it also affects adults. Adult ADHD may present differently, with more subtle hyperactivity but continued challenges with focus, organization, and impulsivity. Executive dysfunction. ADHD affects the brain's executive functions, which are responsible for planning, time management, and decision-making, regardless of the type. Understanding the different types of ADHD helps tailor treatment approaches, such as behavior therapy, medication, and coping strategies, to the individual's specific challenges. Lesson summary. ADHD, or Attention Deficit Hyperactivity Disorder, is a neurodevelopmental disorder characterized by symptoms of inattention, hyperactivity, and impulsivity. According to the DSM-5, there are 3 types of ADHD. Predominantly inattentive presentation. Predominantly hyperactive impulsive presentation. Combined presentation. The subtypes of ADHD, according to the DSM-5, and the historical context of the disorder are crucial in understanding and addressing ADHD. The historical evolution of ADHD includes descriptions dating back to the late 18th century. References like defect of moral control and minimal brain dysfunction. Use of the term attention deficit disorder, ADD, in the 1960s. Development of distinct subtypes and diagnostic criteria in the 1980s. Further evolution with the publication of the DSM-5 in 2013. Recognizing the specific symptoms and presentations of ADHD can aid in seeking appropriate diagnosis and treatment. Understanding the historical context helps appreciate advancements in research and clinical practice. Continued research and education about ADHD can reduce stigma, enhance support for individuals, and improve the overall quality of life for those affected by the disorder. The main types of ADHD are ADHD, predominantly inattentive type, ADHD-I. ADHD, predominantly hyperactive impulsive type, ADHD-H. ADHD, combined type, ADHD-C. Other important considerations include ADHD in adults and executive dysfunction. Tailoring treatment approaches based on the individual's challenges is crucial in managing ADHD effectively. Awareness of the different types and historical context provides a foundational understanding of ADHD. As we conclude Chapter 1 on understanding ADHD, I want to express my gratitude for your engagement and curiosity. You've learned that ADHD is a multifaceted condition, gained insights into its scientific basis, and recognized the diversity of experiences among individuals with ADHD. This knowledge empowers you to create a positive impact, whether by sharing insights or supporting others. Thank you for your dedication. Let's carry this momentum into our next chapters.